Good morning. We've all been through a lot over the past 7 months. The restrictions that we've imposed have been hard on everyone. Not a single one of us has escaped the pain of isolation and the inability to have a life like we had prior to COVID-19. We must also recognize that some of our residents did not escape the disease. In fact, over 800 St. Louis County residents have lost their lives. And on average, another St. Louis County resident loses their life every day. The virus has sickened thousands of other residents as well. Throughout the pandemic, I've consistently promised that we would study the data, listen to experts and stakeholders, observe how the community was reacting, and monitor the best practices of other communities across the country. As a result, I'm here today to make several announcements. Because conditions of St. Louis County are stable enough, we're rolling back some restrictions on youth sports and businesses. And we're also recommending a return to an in-person learning option for high school students. Your sacrifices have made this moment possible. Thank you to everyone in St. Louis County for wearing masks, for social distancing, and for adjusting your lives to keep our community safe. We must all continue to exercise caution and remain committed to the precautions that have gotten us to where we are today. We've always tempered this response to the pandemic with a controlled and steady approach. As a result, we've fared much better than other parts of the country. As I mentioned a week ago, the Department of Public Health has been working diligently with athletic directors and other stakeholders in youth sports to build a path back toward games and competitions for high-contact high school sports such as ice hockey, football, and basketball. Today, I'm announcing that path. Any school district that wants to return to high-contact high school sports must submit a safety plan to the Department of Public Health. These plans must include the same screening, quarantine, and isolation guidelines of other youth sports activities. They must also specify how spectators will be managed. And they must have a pledge that schools will cooperate with contact tracing efforts. Failure to comply with an approved plan means that it will be revoked. The Health Department will begin accepting plans for games in high-contact high school and youth sports immediately. Those plans can be submitted at business-covid@stlouisco.com. Also, we are informing school districts that we now recommend that they offer an in-person learning option for their schools. We recognize the challenges that virtual learning poses, and we encourage school districts to explore a return to an in-person option as they see fit for their students, for their teachers, for their staff, and for their parents. This is a recommendation, not a mandate. And as always, as before, we will continue to support our school districts in whatever path they choose. We also have committed $3 million from the Federal CARES Act funding to support the purchase of PPE for our schools. And in recognition of the hard work of our business community, we are lifting the maximum occupancy of 25% to 50% in all of our businesses based on the fire code. This change will go into effect at 5 p.m. on Wednesday. We are also going to allow a controlled use of drink and self-service food stations in restaurants and convenience stores with limits and precautions. For details on these guidelines, please go to stlcorona.com. So what's led to these changes? 3 main factors. While COVID-19 transmission in St. Louis County is still too high, it's fairly stable, with hospitalizations steady. And a significant portion of our hospitalizations come from residents of our surrounding counties. And we've seen some improvements in the 15 to 19-year-old age group, where the rate of daily new cases has declined 16% from September 15th to September 28th. Also in that age group, the positivity rate has fallen from 7.6% to 5.7%. And we're seeing a lot more testing in this age group as well. And that's another positive sign. Second, residents and businesses have improved their compliance with our masking orders and our social distancing rules. In July, we ordered everyone in St. Louis County to wear a mask in a public place or in businesses. We've seen a strong and growing compliance with that order, which remains in effect. Our businesses have worked hard to enforce the masking and social distancing guidelines to keep their employees and their customers safe. It is critical that those efforts continue. Third, we have collaborated with medical, sports, education, and business leaders. We've been meeting with many groups over the past months, listening to their requests and advice. We've heard from sports medicine doctors and other medical authorities, educators, business owners, and many other county residents. We've studied the best practices in other areas and collaborated with regional leaders and authorities. And in doing so, we refined our guidelines to allow more freedoms while keeping our residents and our community safe. But even as we see this progress, I must point out, this is not a celebration, and it's certainly not a time to let our guard down. I know this has been a long road, but this virus is still very much among us. The only way forward is following our medical experts' best advice. If we fail in our efforts, we'll be forced to enact more restrictions to take steps backwards, and none of us want to see that. We're putting our faith in our school leaders and our athletic directors to follow our guidelines, our social distancing rules, to keep our children safe, and to do everything possible to do so. We're putting our faith in our business leaders and our frontline workers to following our masking and our social distancing guidelines to make sure that their employees and their customers are kept safe. We are putting our faith in every resident of St. Louis County to keep wearing masks, to stay 6 feet away, to wash hands frequently, and to cooperate with our public health officials when they call to do follow-up on contact tracing. It's only by caring for each other that we can move forward. The time for division is past. This virus knows no politics, no race, no religion, no boundaries. We see that in our community, we see that in Jefferson City, and we see that in Washington. The actions of St. Louis County have helped save lives. Your actions have helped save lives. This is a pivotal moment. We are still very much in the throes of a pandemic that has no cure. The future rests with you, the residents of St. Louis County. Thank you, and I would be glad to answer any questions.
In terms of spectators, are you allowed to have any? Are there some restrictions? I know St. Louis City is doing 2 for every athlete.
There will be restrictions on spectators. General guidelines will follow our capacity limitations of 50, but those will be worked through in our plans. Spectators have not been a large and request of our athletic directors. Mainly they want to get the competitions going, and our concerns remain with gatherings and crowds. That's a very difficult way to control social distancing measures. But again, every school that wants to pursue high contact sports for high school students can submit a plan to our Department of Public Health, and they will review that. And the athletic directors should provide details on how they plan to manage spectators at their games, and the health department will review those requests.
And can you clarify the terminology? Practices, are those okay? Are games okay?
Practices have always been okay for high contact high school sports with limitations. So that has certainly been lost in some of the conversation. What we're talking about now is allowing games and competitions for high-contact sports like hockey, football, basketball, among high school students and high school age students, which was one of the remaining restrictions for school sports.
Did any of the handful of county schools that played this weekend in other parts of town have any impact on this decision?
No, what guides our decision over the past 7 months has always been data from our public health department, have been the advice of medical experts and conversations with our stakeholders and observations of best practices from across the country. We are in the middle of a political cycle, and anyone can choose any narrative that fits the comfort of their politics to explain our decisions, but we will continue to follow the best practices. We will continue to follow the advice of our public health experts, and we will continue to follow the data from our community, which at this time is trending in the right direction.
And I know bars and restaurants were an industry that were greatly impacted by the restrictions. Will they have any, I know obviously occupancy can go up, but in terms of the...
We're not
close
going
time?
to limit restrictions on late night activities of bars. Those will remain in place. We are expanding the capacity of all businesses, including restaurants, to 50%, starting at 5 p.m. on Wednesday. We have seen in St. Louis County a really strong compliance with masking and social distancing guidelines, and we believe that our businesses now understand and are in compliance with the social distancing guidelines and masking requirements that are needed to keep their employees safe and their customers safe. And we get constant reports and feedbacks. There is constant communication in the community between residents about places that they believe are safe and inspire confidence. And we believe that that pressure will continue, and our public health department will continue to review complaints about businesses, including restaurants, that aren't in compliance.
I couldn't hear, did you ask about the demand letter?
No.
Did the demand letter at all play into any role of you making this decision here
I'm
today
not
to
familiar
allow
with the demand letter. I think they're
a group of parents, they were saying that this basically was different when it came from public schools to private schools. Not everyone was being treated across the board equally in terms of their restrictions. And
Oh,
so
yes.
there was a letter.
Sure. There's we receive daily communications, complaints, threats of litigation. It's part of the process. It's been here since the beginning for the past 7 months from every industry that's been affected. These public health orders are difficult for everyone. They require sacrifice across all business sectors of our community, and all of those tensions are heightened by the frustrations of this pandemic, of the limitations of our usual ability to get around in the community. They're heightened by an extraordinarily historic partisan political environment, and we're going to continue to make decisions based on our public health experts' advice, on our data that we receive, on our discussions with the medical community, on best practices and observations across the country about what works and what doesn't work.
So the plans that the schools submit need to fall within the guidelines that the county
Right.
has set forward, so
That's right.
i.e. the 50 people max as a
Right, 50 people max with limitations of spectators per parents, and we'll work on those. But again, we remain concerned about gatherings of any size. We remain concerned about gatherings that don't follow social distancing guidelines. And we also recognize that St. Louis County is in a much better place than a lot of places in the country because of these tough decisions that we have made, which require sacrifice from everyone to keep our community safe. Everyone is impacted with loss of life, loss of family members, sickness of family members, potentially lost work or lost wages. Businesses have been threatened, and certainly activities surrounding school have been very frustrating for everyone. We're not through this pandemic yet. We have several months ahead of us before a vaccine is widely available, and these are going to be some challenging times, especially as the winter months get here. And we all need to work together. We all need to be prepared for some measure of sacrifice to keep our community safe.
Is there any plans at this point, or do you have any idea if the county will choose to dedicate staff to ensure that these high contact sports, that the rules are being enforced at the actual events? Is that a
No,
possibility?
the county does not have staff to monitor all of the schools in the community, but we don't need staff. The feedback we get from people who are concerned about the health and welfare of people in our community is an enormous amount of monitoring that is already taking place.
Just to clarify really quick, you said schools can come forward with these plans, also like private organizations, maybe leagues, something like that?
Yeah, so high contact sports and high school age kids were affected by our guidelines. So anyone who's running high contact sports type activities can communicate with the Department of Health about these guidelines and how they could comply with sports and still protect their students and their participants.
You highlighted some of the positivity rates decreasing and things like that. If you can, are you able to maybe point to a couple of benchmarks or guidelines that you feel like we have met that have resulted in our ability
Well,
to be where we are?
sure. I mean, everybody would love to have a number or a switch, but there are a lot of factors that go into our decisions. But the declining positivity rate is important. The increased number of testing in this age group is important. The reports that we get in the community, compliance with social distancing measures, with masking, is important. I would like to see more compliance with our public health officials when they call people to follow up on contact tracing. We still have some folks that do not want to talk to our county employees when they call to follow up on contact tracing, and that presents some challenge. We still have we still need to make some progress in compliance with our contact tracing communication from our county employees. We're watching the medical advances in our country. We're certainly sensitive to hospitalization rates. We're also watching how well people do when they leave the hospital, and we expect medical advances to continue over the coming months. We do not expect any silver bullet or any magic cure, but that's important as well. Well, the hospitalization rates are important to us in St. Louis County, but we know that a significant portion of those hospitalizations are not St. Louis County residents. So we have to be wary of any measure that doesn't accurately reflect what's happening to our St. Louis County residents. And certainly when we have a vaccine widely available, that will change the dynamic a little bit, but we also know that there will be some resistance. There are some people in our community, in our country, that don't like vaccines. And that will slow down our ability to impact this virus. We will still need people to wear masks well into any sort of vaccine effort until we get this under control. So we are not looking at any resolution of this, probably by all information that we have currently today, until next summer. But we do know that, and we do believe that a vaccine will be available to some frontline workers by the first of the year. We believe that that will happen. And following that, there will be efforts made to make the vaccine widely available in the community. And those plans of vaccine distribution are already being made now through our federal government, through our state government, through our hospital systems here, and through our county health department. In the meantime, we do need people to remember to get immunized for the flu, because we do not need a second pandemic on top of the one we already have. We need the flu to be in check this year. Our hospitals cannot manage the extra capacity of a bad flu season on top of this COVID-19 pandemic.
Quick question to circle back. So you said no curfew changes or hours changes to restaurants and bars, correct?
No.
And for smaller county schools, private schools particularly, would any of that 3 million PP, or for the PPE from the CARES Act go towards them, or we're just talking the public schools?
Well, these are, this is a match to to state CARES Act funds. So we're providing a local match for the state funds to distribute that money to the, to schools. I don't know if there's limitations on private schools or parochial schools. We have not been limiting our CARES Act resources to schools. We've been sending them out based on need. And some of our private and parochial schools have taken advantage of some of our county programs based on the need of their students.
I just have a question. So for so long we heard about flattening the curve and not overwhelming the healthcare system. The state reported this weekend that almost 400 hospitalizations in the St. Louis region. You mentioned that those aren't all from St. Louis. Does it matter that they're not from St. Louis, though, when they just come here to get the care that they need, and that can still?
Oh, we're going to take care. We have always, our St. Louis County hospitals have always taken care of people from outstate Missouri, and we will continue to do so, especially our trauma centers. We have helicopters landing daily, bringing in people who are injured from motor vehicle accidents all over the state. So we have a long history of taking care of patients, referred patients with complicated medical problems, non-COVID related medical problems that come to our hospitals, and we continue to take care of them. But we have to be careful at pointing at the hospitalization rates in St. Louis County and believing that that recognizes a trend among St. Louis County residents, because it reflects more of a trend of the state and the referral base, the catchment area of those hospitals. But we certainly will continue to take care of them, and if our hospitals become overwhelmed, then that would put pressure on our entire community, but also the entire state, because we know that across the state, hospitals are becoming challenged in managing their COVID patients. Any other questions? Doug, anything?
Just one point of clarification. So the DESE match, the state match for the PPE is focusing on public schools, but our Department of Public Health is committed to PPE for any school who asks for it.
Okay.
Or private.
Yeah, so we're, so DESE is a public school program. So the match that we've, that our PPE, the $3 million of PPE that our county our county health department is supporting, is a match with the Department of Elementary and Secondary Education, so that would be for public schools. But the programming of our county health department, as I've said from the beginning, is based on need. And if there are high need areas, we will certainly work to try and help them. Okay?
Curfew's at 10 p.m. Is there a question?
Yeah, bar curfew, 10 p.m.
Bargain restaurant.
The restaurants are not limited,
Just the bars?
just the bars in St. Louis County.
I have one more question, something I've heard from some people. What is the difference, in your opinion, between a crowded outdoor patio full of people eating and people sitting amongst each other on the bleachers watching a football game? Are they one and the same?
I will let my health department come up with guidelines for high school sports. There will be many arguments made, and we've seen this from the beginning. When someone believes strongly that an activity that they want to participate in should happen, they will argue passionately, and they will compare it to many different things. But I will let the health department determine crowd sizes and capacities. Every day we are learning more about how this virus travels and about where the risks are and where the risks are the greatest. And as we learn more, we'll make adjustments in our health department recommendations. But they're going to follow the CDC guidelines until the CDC guidelines change. We know that some states across the country, a few regions of the country, have wavered from CDC guidelines on social distancing requirements, on masking requirements, on the definition of a close contact. We're going to follow the CDC guidelines here in St. Louis County. Okay, thank you.